So I'm, yeah, okay. Okay, should I start? Yeah, let me introduce you to the whole, to all of us. Yeah, good afternoon, all, to all distinguished participants and research fellows. On behalf of the Dayanand Sagar College of Engineering Organization Committee, I warmly welcome you to this particular session of the International Congress on Industry 5.0. So before we proceed, I would like to inform you that this particular session is going to be recorded and also being live streamed on YouTube. So it is my great pleasure to introduce the speaker for this session, Dr. Debashis Das. So Dr. Debashis Das has been actively engaged in teaching and research in the field of artificial intelligence at the Department of Computer Science, Birmingham City University, UK, since February 2022. He brings with him over 23 years of extensive academic and research experience, having served as several reputed universities across the UK, Malta, Malaysia, and Bangladesh. He is the author of the book titled Optimization Algorithms in Machine Learning, published by Springer Nature. In addition, he has authored and co-authored numerous research articles in the reputed international journals and conference proceedings. His research interests encompass artificial intelligence optimization techniques, data science, data analytics, data mining, machine learning, and deep learning in biomedical applications, and also the programming languages. His academic excellence has been recognized through several prestigious awards and honors, including the top performing academic award, UMP Research Grant, XMUM Research Grant, UK RI funded project, doctoral scholarship schemes, gold medal for 3 minutes thesis competition, and the merit award for the SCI Index Journal publications as well. Okay, so we welcome you, sir. And
Thank you very much, Dr. Santanu. It's my pleasure actually to join this particular Congress. I would like to thank everybody for providing me this particular opportunity. I would like to, first of all, good afternoon, everybody. In fact, if actually I would like to share my slide, in fact, let me just share the slide. Are you able to see my screen, please?
No,
sir.
on my side, I can't see the screen.
Can't see? Oh, I see. Quite strange. Yeah, it's not actually allowing me to do entire screen. I don't know what's the reason, in fact.
Oh,
Actually,
okay.
you are the co-host, so you can share the screen. Sir, have you logged in 2 devices or 1 device, sir?
Sorry? Are you asking me, please?
Yeah. Debashi, sir, you logged in using one
I have
device
logged
or 2
in
devices?
just one. I think now it will work, perhaps. Can you see now?
Yes.
Yeah. I have logged into actually one device only.
Okay, sir. Thank you.
Yeah. All right. Thank you. All right. So I hope all of you can see my screen, please.
Yes.
All right. Okay. Good afternoon to everybody. First of all, I would like to thank actually to the host for inviting me for this particular talk. In fact, it's my pleasure to actually talk in this platform, in fact, and if I can motivate some of the researchers to actually do the healthcare research. First of all, let me start with a short story, in fact, which is a case of actually the healthcare, which is nothing but imagine there is a lady and her son, let's say, so 4 years old son, in fact. Suddenly one day, her son got actually severely sick. So from that particular moment, that particular lady keep on going to the different doctors, and over the 3 years, she had to go to the 17 different doctors to see what happened to her son. But still, actually, he couldn't get cured. So that poor lady, what she did actually, she got really frustrated and disappointed. And then out of that particular disappointment, what she did one day, actually, in fact, she has gathered all the information, in fact, all the test report, all the doctors' consultation and everything she has gathered together, and she has given to the AI. And within a second, the AI has provided the solution for her son. So this is a case study where actually you can see that how AI immensely affecting the healthcare, how actually it is helping the healthcare, and that's the actually center point of the talk about the actually the AI-based healthcare in the era of Industry 5.0. We'll see actually how healthcare is getting affected by the Industry 5.0. In fact, we should know first what is the pillar of the Industry 5.0, in fact, into the healthcare. We are going to see forward as we proceed forward, we'll be seeing, in fact, how it is affecting actually the healthcare and also how it is actually affecting also the human life, in fact. So myself, Dr. Debashis Das, and as I informed, actually, I have been working at the Birmingham City University. Dr. Santanu has already provided the introduction. So thank you very much to Dr. Santanu for the introduction, in fact. So the agenda for today, we are going to talk about actually what is the Industry 5.0 paradigm, in fact. So it depends on the three, actually, the pillars. We are going to see all those three pillars, in fact, which is nothing but the human-centric, sustainability, and also the actually the in fact another is the resilience, in fact. So we'll see actually how the healthcare is getting affected through this, in fact. So we'll also see how actually AI revolutionizing the healthcare. We'll see how the digital twin is actually introduced into the medicine. In fact, it's a concept of the flight, and that particular experience has brought into the healthcare, in fact. And we'll also see how actually the predictive analytics and the prevention is also helping us, in fact. And also we'll as actually you see to the all the field, in fact, there are the challenges and also the ethical implications. So AI also has to pass through all these, actually, the challenges and the ethical implications. And from there, actually, I'm also going to show a case study, which is actually our own research with the National Healthcare Services, NHS, actually, that we have published into the IEEE publication. We are going to see actually in brief, in fact, for that particular actually the case study. And also I'll also talk about one or two actually ongoing research that we are performing taking at this particular moment. And at the end, actually, we are going to talk about what are the future path that we do have, and also what are the opportunities that we do have, in fact. So at any point, if you have any question, I'll be actually, in fact, I think it's better, in fact, if you ask the question at the end. Of course, I'll keep a session for that particular, I'll keep a session for that, in fact. So let's actually proceed with the evolution of the healthcare. As we see that the healthcare started with the 1.0, which was the manual, in fact. And from there, it has come to the actually 2.0 was digital. And then after that, it was automated, and then actually it has gone to the AI driven, where actually they thought that they will take out human, in fact. And due to that, many different people, they were losing the job. And then we are worried actually what will happen to the human, in fact. So for that particular actually situation, in fact, we should be thankful that they have again brought back to the human and the AI together into the 5.0. So which is nothing but the human-centric, and we are not going to actually remove the human. Rather, human capacity will be augmented through the AI, in fact. So that's how human and AI collaboratively, in fact, performing together. And then we hope that, the healthcare industry will be shining actually day by day. because we do have a pretty hard situation. If you actually just search, you'll be able to see that in the year 2030 we are going to have 10 million to 11 million healthcare professional scarcity. So how to fill that particular gap? In fact, so AI is the only solution that can actually fill that particular gap, in fact. So let's proceed forward with that. Actually, because of the time limitation, I'll proceed a bit faster. In fact, I hope actually you are able to follow that. So let's actually talk about the Industry 5.0 paradigm. As I said that actually Industry 5.0 paradigm is actually based on the three different pillars, which is nothing but actually, as you can see here, human-centric, sustainability, and the resilience. In fact, so the 5.0, actually the Industry 5.0, as we see that, it has to be the human-centric. So human has to be there. We are not going to remove the human. So this is actually the we say that in the Industry 5.0 it is here to stay, in fact, because human and the AI, they are collaboratively performing together. So that's why we are actually keeping the human in the loop now. So next is about the sustainability. In fact, the system that we are going to make, that has to be sustainable. We need to make sure that it is going to actually do the reducing the waste, and it is going to take less actually the carbon or footprint and so on, of course. And that's how actually it has to be made sustainable. The next is actually also the resilience. It has to be resilient. Now let's say some of the complex situation comes, and what happens? Doctors actually, if too many complex actually the patients come for the treatment, doctors, they burn out. In fact, all the medical professionals, they burn out. You have seen that actually during the COVID situation, what was the scenario. So to overcome that, in fact, we have the AI with us. So due to that, actually, the AI based and the human based system, they have to be resilient. In fact, when the lot of complex patient comes, doctors should get the advice from the AI, and then AI should help the task of the doctors and the healthcare professionals. And then actually, it should they should not be actually the breaking down, and they should be resilient, in fact. So that's actually the main pillar of the Industry 5.0, and healthcare also has to adopt all this. And for sure, healthcare will be revolutionizing through this particular actually the pillar, in fact. So let's actually look into it. What is the healthcare in the Industry 5.0 context? As we have seen that it has to fulfill the three different pillars that we do have. So with the help of that, in fact, so AI is going to augment the clinical expertise. I have already said that, we are going to have the scarcity of the healthcare professionals, in fact. So that scarcity can be filled up with the help of the AI. So AI is going to augment the capacity of the human, and that's how actually it's going to help to actually shine the healthcare, in fact. And also, we need to make sure that the healthcare delivery that we are going to provide, that has to be sustainable. I have already explained actually about it, so you should be able to understand it, in fact. And also it has to be resilient, and also it has to be patient-centered, in fact. Nowadays, the AI is actually investigating the gene of a particular person, and based on that, it's going to provide the medication for the patient. So that's how actually it is providing the patient-centered actually care. So which actually was not possible prior to the AI, because any complex cases, immediately AI will actually find the different kind of solution, and then it will provide it to the doctor. So that's how it will provide the evolution into the actually the healthcare, in fact. Right. So let's see how actually AI is revolutionizing the healthcare delivery, in fact. Okay. So for that particular one, we have already said that AI is going to augment actually the human capability, and then human and AI together, they are going to work together. So our purpose is not to remove the doctor or the actually the human. Rather, we want to complement. Actually, the AI comes as a complement to the healthcare professionals, in fact. So for that, the service or the actually the facility that we do see from the AI is actually, you can see that automated image analysis and the detection. That nowadays actually, previously it was so difficult for the doctors and the healthcare professionals and the radiologists to read the in MRI images, CT scan images. It used to take a lot of time, and also they used to make a lot of mistake, in fact. Now actually it has reduced drastically because of the implementation of the AI. So AI has done the augmentation of the image analysis and also the detection of the images. And also, the prioritization has become easier now. Because of the introduction of the AI, real time, actually the real-time support to the patient has become so easier, and actually that's how actually AI is supporting the healthcare, in fact. And also, let's say if we talk about the report generation, it was not so easy to produce the report by the doctors or the healthcare professionals. Now, because of the introduction of the AI, it has gone much easier, in fact. And also, if you talk about the segmentation and the annotation, it was so difficult actually earlier with the help of the radiologist. Now, because of the adoption of the AI, it has gone much easier. And also doctors, day by day, in fact, they are adopting also the radiologist, in fact. Also, AI has introduced the robotic-based surgery, and because of that robotic-based surgery, it has become easier for the doctors, different doctors and the healthcare professionals. They have to support a lot of patients. In fact, sometimes they get burnout. So this burnout issue has got reduced tremendously, in fact, because of this particular robotic surgery and the AI assisted procedure, in fact. And also it has been introduced to the different branches like the urology, cardiac, neuro surgery, and also the gynecology. It is in everywhere now, actually, the robot based surgery and also the AI based solution, in fact. Right. So then actually from there, let's talk about the drug discovery and the clinical trial. You talk about the drug discovery, previously it used to take number of years, in fact, 15 years, 20 years to make a discovery of one single drug. Now, because of the integration of the AI within within few, maybe 10 days or the 15 days, or maybe within 2 months, it is so actually it has been possible to do the drug discovery. And also, clinical trial, it was so difficult earlier. Now, because of the introduction or the integration of the AI, it has gone much easier, in fact. Right. So another actually problem into the healthcare that I mentioned earlier also during the pandemic time, it was the providing support to the people who are actually living into the remote area. In this case, I would like to bring a case. If you actually look at the scenario all over the world, 4.5 billion people, they do not have access to the complete healthcare. Half of the population of this particular world, they do not have healthcare support. Can you imagine the situation, in fact? Also, in this case, I would like to bring a case. I got suddenly sick actually last month, and then actually what I did, I tried to get the actually appointment from the doctor in UK. So when I called to the actually the clinic, they said that, okay, you have to wait for 15 days. Come on, I'm suffering, and then I have to wait for 15 days. So what I did immediately, I just go and search with the AI that what is the solution for that, and then based on that, I have taken some sort of medication, and they have given me the appointment 2 weeks later, and within that time I have already got cured, in fact. See, that is the situation, and that's how actually AI is revolutionizing, in fact. So half of the population of this particular world do not have the complete healthcare access, in fact. So this is really it is really worry situation. In fact, we need to address this particular situation. Yeah. So because of the AI or integration of the AI, it is possible to provide the support to the remote, actually the patient, and also it is possible to do the monitoring, and also it is possible to do the telemedicine. In fact, as you can see that based on the architecture that I'm showing over here, it is possible to provide the support to the remote patient. That, so we should be thankful to the AI for all this, in fact. All right. Now let's talk about the digital twin and the personalized medicine. As I have told you, this is just like the flight-like situation. In fact, the doctor, let's say previously, they were directly going to do the surgery, or they were directly giving the medication to the patient. So what happens, some of the patient, they may react with that particular medication, and because of that, many lives we have lost many valuable life, in fact, because of that kind of situation. But nowadays, because of this digital twin, the doctors, they are going to have actually a situation which is a flight-like situation, in fact, and where actually, they may test before giving to the actual surgery, they can test it, and also before giving a particular medication, they can actually test it beforehand, and then only they can implement it for the particular patient. So this actually, the digital twin has brought another revolutionizing actually, scenario for the healthcare, in fact. Right. So and also let's talk about the genomic medicine and the AI driven precision, in fact. As I have said, nowadays it has possible to provide personalized medication. So they are going to analyze the gene, and based on that particular gene, they are going to see whether that particular drug is actually applicable to a particular patient or not. Okay, so this has been possible because of the in fact, AI, and actually AI has actually also grown into every corner of the healthcare, and how it is actually affecting the healthcare. That's what we are seeing here. Right now, let's come to the predictive analytics and also the prevention. So let's talk about a situation. Let's say because of the predictive analytics, I can say that just look at my watch. My watch says, "Hey, Debashish, you didn't sleep last night for 6 hours." And also, maybe I haven't gone for the exercise today. So immediately the watch is going to tell me, hey, Debashish, you didn't actually do your exercise today. And because of that, you see now, so I'm actually much aware that, yeah, I have to go for enough sleep, so that actually, I don't get sick. And also, because of not doing the exercise, I'm having the other health issues. So this has been possible because of the predictive analytics, and then see actually how AI is affecting the human life. And because of that, because I'm doing the exercise and because I'm doing enough sleep, I don't need to go to the doctor quite frequently, in fact. So that has been reduced, as you can see that. So readmission has been reduced, hospitalization has been reduced, length of stay has been reduced. Everywhere, in every corner of the healthcare, AI has actually done the transformation, in fact. Right. So, but as I informed earlier, it is not without the challenge. It is everywhere into the if you go to the any field, in fact, you are going to see the challenges. So AI has to also go through the challenges and also the ethical scenarios, in fact, it has to pass through. So as a researcher, it is our responsibility, how we are going to actually overcome these kind of challenges and the ethical considerations. I would like to actually request all of the people that who is enjoying or who is actually viewing this particular session, please do consider about these challenges and also the ethical considerations. Also, please do try to take some of the some of the area into the healthcare, so that you can contribute for the human, in fact, because as I have informed that we have a scarcity of the healthcare staff. We have half of the population in this world, they do not have access to the healthcare. So we really need to do something for it. Right. So the challenges that we do have, the AI is a black box problem. As you know that this has been reduced nowadays with the help of the explainability. So we have introduced that explainability, and because of that, actually, the black box problem is no more. But of course, we need to make sure that whatever AI model that we are using, they are explainable, in fact. And also, we do have the problem of the bias and the equity issues. We have the regulatory gaps. There are different regulatory commission, HIPAA of the USA, GDPR of the UK. They do say that, no, you cannot do this. You have to actually follow the guidelines. So they are kind of actually, organization. They do, regulate the healthcare data and also the healthcare based, in fact, innovation. So we need to make sure that we need to fulfill these regulatory, actually, the issues. And also data privacy, that is another one we need to actually address into. We need to also address into the generalizability. Sometimes, one of the solution, it may work into the USA, but it may not work into the India. Then how to overcome that kind of situation? That is another actually the problem that we need to address as well. And also another question is, who should be held liable? Let's say because of some of the treatment, a person has lost his life. So who should be held responsible? Is it the AI, or is it the doctor, or is it what actually? What who should be held responsible? So this is a big challenge, in fact, into the AI. We need to address all these issues, and if we all participate together, if we all do the innovation, one day definitely these kind of challenges will be able to overcome. Although it's not possible to completely actually come out of this situation, but we do hope that as the time goes, we'll be able to improve it somehow, right? So for that particular situation, that challenges that we do have, there's a solution which has come to the actually the world, and that has gone a lot of attention to the different healthcare professionals and also the researchers, which is called as the federated learning. Because of this particular federated learning, it has been made possible that let's say previously the data access was so actually the difficult. So a particular data, now different kind of university and the hospitals and also the labs, in fact, they collaborate together, and they do share a common actually the data set into the secure environment. And because of that, you don't need to have the local copy of the data set to every places, and that has been possible with the help of the federated learning. So this particular federated learning is gaining the actually a lot of attention, and you can see that within the next three years, it is possible that 400% growth you are going to see into this particular area, in fact. So these are the some of the actually the places where we can think of that we are able to do actually our further research and all. Okay, so with that, actually, I would like to bring a particular case study that actually we have undertaken, and we have published a paper into the IEEE. As you can see that this is the link of that particular actually the article. So this article we have published. Actually, the project has been undertaken with the help of the National Healthcare Service in UK, okay, and with the Birmingham City University. Actually, so what we have done here is that actually AI-based fat quantification we have done. So because of the superficial fat and because of a kind of fat, in fact, we get the different kind of diseases like the diabetes and the heart diseases. So what we have done, we have actually used the AI to do the quantification of that particular fat, how much that particular fat a person is having, what's the limit the person should have, and then the person should be having a particular limit of that particular fat, so that they do not actually get the diabetic and the heart disease, all this kind of thing, in fact. So what we have done, we have used the AI for that particular fat quantification. We have calculated with the help of the AI. We have taken the CT scan, and actually with that particular CT scan, we have performed, so we call it as the data collection. This is a real-time data, by the way. So we have the radiologist in our team, we had the doctor in our team, we have the AI professional in our team. So it's a collaborative, in fact, project by which we have done the fat quantification. So this is our actually the research work, where we have taken the actually the real-time data, and then we have done the segmentation to actually identify the superficial fat and also the actually the fat that I have talked about. And then after that, what we have done is we have done the pre-processing. We have done the few augmentation and all into that particular segmented data. And then after that, we have applied the model. We have done with a particular model. We have done the first phase training, and then we have done the second phase training. After that, what we have done the post-processing, and with the help of the algorithm, we have calculated the amount of fat that particular person is having. Then actually, so this was the overall task that we have undertaken, and we were successfully, in fact, able to identify the fat. And our model actually has performed AI-based model. Of course, it was the CNN-based model, and then we have actually improved that particular CNN-based model. It was the modified, of course, the CNN, and with that particular one, actually, we were able to get the 96% accuracy of our model, and then we were successfully able to identify the fat of a particular person. And at the end, the radiologist, in fact, they have they have verified it, whether the fat quantification that we have done, it is correct or not. So that's how you see the human and the AI together actually working so that we can create a different kind of solution, right? So this was the one actually the case study or the project that we have undertaken. So I have another project now with my PhD student, which is about the dementia detection, so which is another area. A lot of research is ongoing, so we are planning to apply the AI so that we can do the progression tracking. Yeah, so that's a project. And we have another project, of course, we are going to take pretty soon with Dr. Santanu, which is about the Alzheimer detection. In fact, also another project we are planning to do, which is Parkinson detection. So that's how we are trying to contribute. So I would like to actually request all of you to do some contribution into this particular healthcare, so that together we make this world livable, and also people get actually healthcare access pretty easily, right? So with that, actually, in fact, I would like to provide some I would like to shed some light on what future research opportunities that we do have. In fact, into the healthcare, we have a lot of actually the research opportunity. So if you can just jump into the healthcare and the AI, definitely you are going to get a lot of actually the thing to address. So people, they are thinking people are losing job, there is no job, no job, no job, everywhere people are saying that nowadays. But believe me, if you are actually working with the right area, if you are doing actually the real contribution, then actually you will not be losing job, rather you will be giving job to the other people, in fact. So if you are not actually AI literate, definitely, if you close your eyes that, okay, whatever is happening with the AI, let it happen. If you do it that way, definitely you'll be losing the job. But if you actually learn AI every day, you do update yourself, then actually at the end, your job will not be actually replaced. Believe me, rather, your job will be opportunity of the job will be increasing day by day, in fact. So let's actually talk about what are the future opportunities that we do have. We can actually do the AI augmented clinical decision making. As I said that, in fact, human decision like the CT scan and also the MRI, all these can be augmented through the AI, in fact. So day by day it is going to get improved, in fact. So you can actually do the you can do the research in that particular area. And also you can see that AI or adoption of the AI will be increasing to the different area day by day. In fact, it is going to the to dentistry even. It is going to go into the orthopedics. It is going to go into the ophthalmology. There are some actually solution now which is able to say successfully, different kind of actually diseases, in fact, into the eye. I think 50 different kind of diseases AI is able to say, to the AI is able to predict, in fact. So which was not possible by the even the by the specialist, in fact. So, and it's possible with the help of the AI. And also it will be actually adapted into the pulmonology in the future. And also it will be possible to provide the hyper personalized care, as I said that, by using the gene actually the sequencing. AI will be able to provide the personalized actually medication to a person. So in fact, this kind of a solution will be increasing day by day. So we have to in fact think about it, and then we have to work with it so that we can make some contribution all together. And also another area I have already discussed about, which was the federated learning. Okay. And also the radiology, radiologist nowadays they are actually thinking to do adopt the AI, and it is increasing every time, in fact. So these are just some of the future area where actually we can think of doing the contribution. And of course, should not think that just AI is going to contribute alone. Rather, as I informed earlier, it is the augmentation of the human capability, and then actually the collaborative participation of the AI and the human together, in fact. Right. So with that, actually, I would like to conclude. I hope that actually I think I have taken a bit longer time, but actually I would like to conclude that we should embrace the human-centric intelligence. Okay. And as we said that AI and the human, we should work together, okay, in a collaborative way. We should not think that AI is taking our job. No, actually. So rather, we should think that, AI is complementing my human capability or healthcare professionals' capability. And because of that, which was not possible earlier, and all of it is possible actually nowadays. I think we should embrace, due to that, the AI, and then we should work together with the actually the AI and the healthcare. Okay. So with that, actually, I'll see whether anybody has any question. In fact, I have said a lot of things, and I was actually the pretty fast to cover a lot of things. In fact, I do understand that. I'll be more than happy to actually, do collaborative research with you people. If you think like you have some good area to do actually the collaboration, you are more than welcome. Actually, I do actually collaboratively research with Dr. Santanu, as you know that. And also we are actually also collaboratively working with actually some of the doctors from Spain, actually. This way we do collaboratively actually try to find a particular solution, so that actually we can produce some good solution end of the day. So you are more than actually welcome to email me. I have provided my personal email address. If anybody think like you have a good area to do some more research, we can collaboratively work with that. Please do reach me. In fact, you can email me through this. With that, actually, I'll see if you have any question, anybody, in fact.
Thank you, sir, for your valuable talk. That was really changing our perspective towards AI. And as you mentioned, that AI healthcare 5.0, like human intervention and the AI, both are actually required. So I really agreed with your point. So we are open for taking any questions. I think in the chat box, some of the faculties or students has some questions. Let me read it for you. Okay.
Yeah, Dr. Santanu, yeah, thank you very much actually, yeah, for reading the question. I think it's a really pretty big question. So let me just tell you, I'm not actually the doctor, so maybe I'll not be answer a lot of things actually. In fact, the doctors, they will think like, hey, you are actually, talking about something. But of course, about the AI perspective, I'll be talking. But if anything actually related to the healthcare and the medical, I think I should not be talking about that, because there are many things, regulatory issues and so many issues. So, but of course, in the perspective of AI, I should be able to say actually anything.
Okay, thank you, sir. The first question is asked, automated image analysis relies on annotations and labeling, which require human intervention. But if the leveling quality is poor, then the resulting model performance degrades. So how effectively can AI handle this particular dependency on human generated levels?
In fact, that's what we can see all over the world nowadays. There are the AI. In fact, AI is also doing this particular annotation. We should not say actually, because earlier we used to have the only the radiologists, they used to do the annotation, and because of that, it used to take longer and the longer time. But nowadays, because of the AI, in fact, AI is having the different kind of the like the segmentation and all these, and because of that, actually the annotation has made easier. And that's what actually I have said, we have already done that actually into our fat quantification. We have done the segmentation of the images and all, so that's how we can actually introduce the AI to do the task. But of course, if let's say we leave everything to the AI, it may so happen that there is actually possibility of the errors and the mistake. So to overcome that, I think I'll say that the AI and also the radiologists, they should work together. That's what we did actually for our own project. I think we should not remove anybody directly, not to remove the radiologist. Rather, with the AI and the radiologist should work together. Let AI handle the annotation, and after that, let the radiologist check whether it is done correctly or not. I think that's how actually we can also maintain the Industry 5.0, in fact.
Okay, thank you,
Next
sir.
question, please.
Next question is, how efficient and reliable is AI in supporting decision making and execution of in surgical procedures?
In fact, as I informed earlier, You see, look at the AI based system. In fact, look at the accuracy of the AI based system. If you talk about the diabetic retinopathy, it is over 90% is the accuracy of the AI. But look at the human doctors. If you ask them, diabetic retinopathy, 70 to 74% is the accuracy. So you see, we have in fact AI based system which can perform much better than the human. But of course, we should not say, we should completely remove the doctor and then we just do it with the AI. So we really do not need to do that. But what we do is use the AI's facility that we do have, but with the supervision of the doctor, in fact, so that the possibility of the error will get reduced a lot, in fact. So if you look at the all over the world, the AI-based system, the accuracy of the AI-based system and accuracy of the human-based system, much lower it is. And it's impossible to analyze so much data within minutes, in fact, by human, which is possible just by AI. So that's why the reliability and also the efficiency, if you think about, definitely it is much better in AI. So due to that, humans should use actually the AI's expertise, in fact.
Yes, thank you, sir. The third question is, how can we trust AI systems when they are prone to hallucinations and generating incorrect or misleading information?
Yeah, I think I have already answered this question. Let's say
Yes.
we know that this is, of course, the AI is going to make mistake. There is nothing in the world actually without the mistake. And who is actually, creating this AI-based system? It's human only, right? So human also sometimes give the, wrong information or something like that. So what we need to do is, as we have mentioned, the human and the AI, they should work together. That's why the 5.0, we need to actually make sure that it works on that particular pillars, it stands on that particular pillars, and then they do complement each other, so that we do not have the hallucination problem and also the incorrect result. In fact, you see, if you think about the incorrect decision provided by the doctors, it's a lot. But if you talk about the AI, of course, it produces actually some sort of incorrect information. So that's due to that reason, the human doctor and also the AI based system, they should work together. We should not leave completely to AI, we should not leave completely to the doctor, in fact, rather complement each other, work collaboratively, in fact.
Thank you, sir, for your answer. The next question is, I am rural. Often, local hospitals cannot handle some critical cases, and delay in recognizing such cases causes problems. Can using AI in quick identification of such cases can be a solution?
I think already I have started with a story, right? That's what happened. When you go to the doctor, actually you don't get the doctor. When you go to this doctor, say go to that doctor says go to that doctor. Actually, what is our objective now is to bring hospital in your home, right? That's actually the objective of AI. So what you do is, let's say you know your symptom, you actually provide that particular symptom to the AI based system. Most of the time, AI based system should be able to provide you the solution. Let's say you want to double check whether the solution they have provided is correct or not. Maybe you can get a doctor's view, that you can say, okay, I have got this particular solution from the AI based system. Do you think it is reliable? Do you think I can go with it? So you can verify it, and then that's how we have to do. I'm afraid, and as I said, that you have seen 4.5 billion of the people all over the world, they do not have the full healthcare access. It will take time. So we need to really wait for that. But actually, in the meantime, what we can do, we can provide our case, get a solution from the AI-based system, verify it. Blindly do not trust it. Rather, you verify it, and then actually you adopt that particular solution. You accept that particular solution. That's how we have to go. And above all this, also, I know it may so happen sometimes we may have some certain situation. So that is actually exceptional situation. I think we need to accept that. AI also may make some exceptional kind of situation. Yeah. So it is not beyond everything having the limitation. We have to accept that. And as the time goes, definitely it will improve. That's what I can say, in fact.
Okay, thank you, sir, for your answer. Next question is, collection of healthcare data sets is the biggest problem. how to overcome this particular issue? Are there any good websites available?
Very good, actually, the question. Even, we are also having the same issues. Dr. Santanu, I think you will be agreeing with that. In fact, how challenging it is to get the good healthcare data set. In this case, actually, as I informed you earlier, federated learning, we have seen that, where actually, different hospitals and the labs collaboratively actually working with the data set. Because we do not have the data set for the Alzheimer and the Parkinson, me and Dr. Santanu, we said, let's collaborate with the hospital in actually Spain. So that's how we need to work. What you need to do is you need to look into the research paper and look at that, which researcher is working on that. You knock that particular researcher. One researcher didn't actually open the door, go to the next researcher, then go to the third researcher. That's how for sure you are going to get somewhere some access. Believe me, I can tell you that, for the Alzheimer data set, I was searching everywhere. In UK, I have requested everybody in the NHS, whoever having the data, they just keep it like a great wealth. They don't want to share it with anybody, in fact. So what I did, I started knocking here, there, everywhere. Finally, I have got the data from USA. Full data access I have got from USA, in fact. So that's how you have to do. I know it's a challenging. So what you have to do, the person who is doing the research in that particular area, keep knocking to those people so that they can share the data set with you. I know it is a great challenge, but you should not be working with the Kaggle data and actually all those public data set all the time, because you know that you cannot rely on those particular data set, but it is always better to get the real-time data. So for getting the real-time data, you need to keep knocking the people and the researcher. I know in different universities, we have very good researcher who is going to share. Whatever data set that I do have, I'm more than happy to share. If you think that, okay, we can do some collaborative research, I'm more than actually happy to share that particular data set. So that's how I know hundreds, thousands of people all over the world, they are actually happy to share their data set. And that's how actually we should work on this. I know it's a challenging, but we have to actually accept it. And then that's how actually it has to go through, because of the, privacy issues and a lot of regulatory issues. Anybody cannot share the data, they'd like. So that's why we need to go through all this situation, in fact. And for that, you need to keep looking into the data set where it is available, in fact.
Thank you, sir, for your answer. The next question is, you have mentioned a modified CNN. Can you please explain what modified CNN architecture you used and elaborate on that?
Okay, let me just actually open that particular, just a short, actually. I think otherwise it will take a longer time, in fact. So in that case, let me just, I think you can actually go through the paper. We have done the, actually, what do you call? We have done the comparison of the different, actually, the CNN models. I think, let me just actually take you to the paper. We have the different kind of CNN architecture that we do have. Different people have modified the CNN into the different way. So we have named it as the actually the modified parallel net. If you can actually know that model name, which is called as a parallel net model, in fact. So what we have done the modification of that parallel net. So I'll actually just show you in short. In fact, I'll share the actually paper. Into the paper itself. I don't know whether am I sharing the screen now or no?
It's showing slides only.
It doesn't show anything, right? Am I
It's
sharing the screen now?
your slides only.
Slides only. Okay. I see. Oh, so yeah, it doesn't allow me to actually share the whole screen then. Okay. Just hold on. I'm just trying to share then another one then. So I'll take off this sharing and then I'll share. Yeah, I think it shares now. Modified parallel net. Okay.
Yes, it is visible now.
Yeah, okay. So as you can see into that, what we have done into the paper is that actually we have done the modification of the CNN, And for that modification of the CNN, we have used the modified parallel net. If you can just go through this paper, I think it will be better. You will better understand this particular paper. And also, as you can see that we have used the modified parallel net, and also we have done the comparison of the modified parallel net with the other, actually the kind of CNN architecture, as you can see here. Okay, let me just actually zoom it a bit more. So as you can see that we have done the modification of the parallel net, and then actually we have done the comparison with the UNet plus attention UNet, neural network based UNet, and then R2 UNet. So these are the different kind of, actually, the CNN based architecture. So different people, they do the modification of the architecture in a different way. In fact, if you know the CNN, so different people, they define it different way, and based on the requirement of that particular problem that you do have. So that's what we have done. We have the parallel net. We have done the modification of the parallel net, which we call it as the modified parallel net, with the help of the hyperparameter tuning, in fact. So that's how, actually, we name it as the modified parallel net, in fact. So if you are interested in this, actually, you can go through this particular paper. In fact, I think I have already shown you the link for the paper. If you can look into it, actually, this is the title for that particular research, in fact. So you can go through this and you can look into it, actually, what are the overall task that we have done. Of course, it is not possible, actually, within this particular limited time to actually explain everything over here. So as you can see that this is the paper, actually, that is about the fat quantification, in fact. All right, so let's actually proceed to the next question, please. Okay.
There are no questions left. From my side, one question, please. So I would like to know, suppose a new researcher wants to collaborate with hospitals and want to collect some data set from the hospital. What are the proper steps should be there, or what are the ethical issues can be there in this particular data set collection?
That's a very good question, Dr. Santanu. You said it's 30 minutes now. I think I'm taking 1 hour time. Actually, I do apologize to the people, in fact, because of taking a pretty long time. Okay, to the new researcher, in fact, what they should do is they should try to do the collaborative research. In fact, directly if we go and if we approach a particular hospital, they may not be agreeing on actually providing you that particular support. Also, the challenging part is that you actually, the healthcare professionals and the doctors, they are really busy. They do not have time to do this collaboration. So what you need to do is you need to find, actually, a particular person who can actually provide you the support. So that's what we did. You see, we have knocked to the different NHS, National Health Services, in UK. So we need to find who is involved in research. In fact, there should be people who is having the interest into the research. If you directly go and approach to the doctor, they will never fulfill your request, in fact. So what we need to do is we need to see whether there is a person who is having some sort of data, and also who is interested to do the further research. And also you need to show them, you have to make 1 or 2 solution, let's say. Make a great solution, 1 or 2. Then with that particular solution, go and approach to the doctor. Doctor, I have produced a solution like this. Will you be actually happy to test my solution and then use it actually for your treatment, in fact? So if they see the result, automatically they will be interested, and then they will be able to provide you the support. Otherwise, if you just go directly, there is no chance, in fact. So that's why I would like to inform the new researchers. What you do is try to build 1 or 2 healthcare solution, and then with that particular solution, you show your potential. Once you are able to show the potential, the world will would like to provide you the opportunity. And let's say you go to the one hospital, they don't provide you the opportunity. Go to the next hospital, go to the next hospital. That's how you will get at least one hospital where actually there are people who is going to support you. And also, I'd like to actually inform you in this case, in India, doctors are pretty busy. They are not going to support you. So try to look into some of the good hospital where actually there are researchers and there are actually the doctors who wants the AI based solution, not those people.
30,000 calorie tenderly. Baby, ಈ ವ್ಯಾಲೆಂಟೈನ್ ರೋಸ್ ಬೇಡ ಪ್ರತಾಪ್ ಕೀಸ್ ಕೊಡಿ ಗಂಟಿಲ್ಲ ಯಾಕೆ ಎಂತಿರುದು
Sorry, Dr. Santanu.
I would request someone, some sound is coming. Please mute your mic.
Yeah, okay. Yeah, I can see that here even. Okay, so what you have to do is, try to knock those actually the good hospitals where there are researchers, where there are doctors who is waiting for actually the getting some sort of solution. So try to actually get access to those kind of hospitals instead of trying to the any hospital. If you go to the local hospital, for sure, they will not be happy to actually provide you the support. So that's the actually the advice from myself, and that's how we do. And also, we get disappointed with 100 hospitals sometimes. They don't accept our request. So still we have to accept that. So and we have to keep trying. And if you keep trying, you will never get disappointed, and you will never actually if you work in some path, one day you will get that particular path. Actually, one day you will get to your destination. So that's what I do believe, and that's how we do work, in fact. And Dr. Santanu, you know that how we do get the data set, and how we do get the collaboration with the people. So we have to keep trying, and one day definitely you will be succeeded. I can tell you that.
Thank you, sir, for your that insightful talk. We are all very much thankful for your advice. Let me give some closing statement. Through this particular talk, we came to know that AI can totally replace the doctors, which is Dr. Devas is called as a AI healthcare 5.0, where the human intervention is equally more important than only assisting the AI. So you have been also given a depth explanation of how AI can actually assist doctors and revolutionize the field of healthcare. And so that's why this particular talk was very much feasible in this particular international congress of Industry 5.0. Again, thank you, sir, for your having a great talk and having some advices. We shall definitely collaborate with you, and in future we shall have lots more, many more discussions on research. Oh,
Thank you very much, everybody. In fact, I would like to inform all of you that we'll be more than happy to collaborate in any way we can collaborate in the future. So I have provided the contact details already. So I'd like to see that some of you actually would like to provide some sort of solution for the world. My intention is to provide some solution for this world. When I leave this world, there should be something. I hope all of you should be aiming for that. In fact, I'm very happy to actually talk in this particular platform, in fact. So I look forward to collaborating more in the future. Thank you very much. Have a good time, in fact. I hope you will have a good time all together. Or am I the last speaker, or you do have more speaker for today?
I think so. This is the last talk. Yeah.
Oh, I'm the last speaker. Okay. I'm sorry, actually, if I have kept you for longer. Enjoy the rest of your day. I look forward to see you in the future. And I'll be more than happy to collaborate with you. Thank you very much. Namaste.
Thank you, sir. Namaste.
Okay, so ma'am, shall I close? Okay, so we have reached the end of the International Congress. I take opportunity to thank everyone. Firstly, I would like to express my sincere gratitude to all the participants for their cooperation in making this International Congress a success. Extend my heartfelt thanks to the DSE management for their constant support in conducting this International Congress. I'm deeply grateful to the principal of DSE, Dr. B. Prasad sir, for his valuable guidance and encouragement. I wholeheartedly thank our head of the department, Dr. D.R. Ramesh Babu sir, for his continuous support and motivation in organizing International Congress, which helps in enriching our knowledge and understanding. I also thank all the faculty members of the Department of CSE for their support and cooperation throughout the event. Once again, I thank all the